Hello everyone, welcome to another episode of Let's Talk Health. Today we have Dr. N. Mallikarjun Reddy, Professor and Senior Consultant of Robotic Urology and Paediatric Urology at Citizens Hospital. Hello sir.
Hi, good afternoon.
So my first question for you is, what is the role of robotic surgery in pediatric healthcare?
Okay, robotic surgery has evolved over a period of time. Most importantly, we need to realize that surgery in children is a lifetime undertaking. Because it's not like in adults that we do a surgery and then over a period of very short time they are fine and they go home. But these children have these congenital defects and they have problems which would haunt them for their lifetime. So whatever we do has to be followed up for a long time and their repercussions will be seen in life. So if previously we used to do a lot of open surgeries, then came in minimal invasive laparoscopy. But there is a significant limitation in laparoscopy that it was in the hands of very few people and it was very difficult to perform in the small kids. So we were one of the few people who actually initially did a lot of work on minimal invasive surgery in children. We have even published our data way back in 2005 in American Journal of Urology. So then subsequently robotics came up. What robotics did is that it improved the dexterity of the surgeon inside the abdomen, because the instrumentation of the robotics would allow the surgeon to operate easily. And then because of the significant magnification in the 3D imaging it gave much more precision to the surgery. Now, how does it translate to anything in urology or any pediatric surgery is, the child would go home early, there would be less pain. Once the child goes home early, the parents are ready to go back to their work early. And then because of the precision, we had much better outcomes, which actually translated to better long-term life in these kids.
Are there any specific conditions or diseases in children that are commonly treated by using the robotic surgery?
Yeah, majority of robotic surgery today is being used in urology, or the problems with the kidney, bladder, and the bladder. So these are the areas where actually you can reconstruct and then you improve the drainage of the kidneys, or you decrease the reflux. So there are various things, but the majority of usage of robot today is in the urological diseases, even in children.
What are the type of surgeries that can be done using the robotic device in the pediatric population?
Now, before we get to the number of surgeries, let us know at what age can we use the robotic surgery. So we have actually performed surgeries by robotic in 21-day-old children on the kidney, and is qualifies to be the first in India to be done. It all depends on the disease process. Now, if we actually look at what surgeries can be done or where the children would benefit, let us divide it into the kidney, ureter, and the bladder. There are areas where children are born with duplication of the kidney. That means the kidney is divided into two parts, and these are the kidneys which have one of the kidneys would start swelling up, and then because of the obstruction. So there we can actually remove the obstruction and put back the normal passage back into the normal ureter. The second thing is called a Peauge obstruction, which is the most common thing, where the tube which connects the kidney to the bladder actually gets obstructed near the kidney. So these kidneys, most of the children today, we actually identify them before birth on an antenatal scan. So these on follow-up, we know whether the kidney is becoming bigger or swelling more and the function is coming down. Now these are the kidneys who needs to be operated. So there the robotic platform helps us to identify the exact length of the narrowing and then remove that and put back the normal tube back to the pelvis so that the urine drains normally. The third common surgery which is performed is called ureteric reimplantation, or where the child has the urine. Normally when anyone passes urine, the urine comes out rather than going back into the kidneys. Now in these children, the urine tends to go back into the kidneys. Many a time we actually operate a little later in age, that means somewhere about 1 year or plus, because the bladder has to grow a little better. So this is called ureteric reimplantation, where we actually create a situation where we put a little more bladder so that the urine does not go back when the child is passing urine. But what this does is it actually decreases the infections and the future kidney failure. But the most uncommon things which actually the robotic helps is in bladder neck reconstruction. That means where children are incontinent, where they continue to dribble urine, they cannot hold urine, they keep using a diaper right till their older ages. So these are the children where we can actually correct the bladder neck or the area which actually needs to hold the urine, and then we allow them to hold urine and then pass with normal voiding. The other important area which very few people would do is in a neurogenic bladder. That means where children have neurological problems, they have myelomeningocele or they have been operated on their backs, or there has been a spinal problem on their back. All these children will have the bladder would not be correct. Either there would be a bladder which has got higher pressures leading to incontinence, or there could be large bladders where they cannot empty. Now, what happens in these particular situations is these children tend to develop regular infections. When they develop infections, and these are infections into the kidney. And ultimately, all these children who have these back problems and the spinal problems, left alone, unfortunately, would succumb to kidney failure rather than to any of the spinal cord problems. So, in these children, we need to do something called clean intermittent catheterization, or we need to allow them to put a small tube either through their urethra, through the penis or natural urethra, and then empty the bladders. Now, where does the robotic surgery come here is that when these children have to go to the school, we don't have a school which would allow these children to catheterize themselves. So, we do something called a Mitrofanov, or use the appendix to actually bridge the gap, or have a catheterizable conduit, what we call, is a passage from the skin to the bladder through which these children can put a tube without pulling down their pants, and absolutely it would be painless, then empty the bladders. The other area where these children benefit on a robotic surgery is where these children with neurological problems have fecal incontinence. So we do something called MACE, where we bring out a small area of the appendix, and then they would do an antegrade enema daily in the morning, where they put in about 200-300 ml of boiled cool water into the colon, and the whole colon empties, and they are fecally continent all through the day. Now, people who are incontinent would really know how unfortunate and how bad their social lives are, and then we can endear in making their social life much better. Now, another area where, again in the neurogenic bladders, where the bladders are small and thick, where they are producing a very high pressure, leading to hydronephrosis and causing kidney failure, there we can use an intestine to actually improve the capacity of the bladder. So these are the complex surgeries which the robot allows us to do with much ease, and thus decreasing the morbidity. Now, when I say morbidity, the recovery rate for the child is faster. They get back to their oral feeds much earlier. The pain post-operatively is significantly lesser, and then their outcomes are good. So the robotic platform has definitely revolutionized the segment of pediatric urology. The only issue is that this is constantly or very commonly done in the Western world. India is still not taken it up because of a little cost constraints. But I think the costs actually over a period of time would not matter, because if you do an augmentation with a big incision, or the incision would grow with the child. So now with few ports, the child would actually be cosmetically good. So, and because they recover early, the costs are actually mitigated. And these kinds of platforms, definitely if they have survived in the West for the last 15 years or so, it is time that we also embrace it and then give our children the advantages of the robotic platform.
Is there any age limit or certain criteria that qualifies these kids to undergo robotic surgeries?
Yeah, it's a good question, Anusha. Very small kids, actually, until unless you have an expert hand, you cannot get in. A lot of people do most of the robotic surgeries at 4 to 5 years of age, but we are able to do it right from the neonate, that means from 21 days. So, in an expert hand, age is not a criteria. Limitations, every surgical aspect has a limitation. So there are certain things where if you have to put a big incision at the end of the surgery and then you want to do it robotically, it does not make sense. So there are abdominal wall reconstructions or something like an extrophy where the bladder is totally outside the abdomen. So these are cases where the robotic surgery may not be would not be appropriate. Something like hypospadias, where the urinary hole is way below the normal tip of the penis. So those are the where we don't need to do robotic. But anything inside the abdomen, I think by far 99% all of them are amenable for robotic surgery.
How do you as a surgeon ensure the safety and precision of this procedure on these little kids?
Yes, I think the bottom line for any surgery, whether it's robotic, laparoscopic, open, is first is safety. The second comes the delivery of the result. So there are a lot of safety aspects which are inbuilt into the machine of the robot. I think before I talk about safety, I think people should know what is robotic surgery, because a lot of people think that you put in a robot and the robot goes in and then start doing something inside the abdomen. No, it doesn't. What a robot does is there are robotic arms, there are the instruments which are placed into the abdomen. These instruments have got 7 degrees of motion, which are much better than the human wrist. And then the surgeon is sitting at a console where he is operating that robot. Whatever I do, the robot replicates itself inside the abdomen and it does the surgery. Robot does not have a brain of itself and it does not function on its own. But what brain it does have is, if I do some jargon movement or something which is not appropriate inside, it would stop functioning. So there are a lot of safety aspects inherently built into the robot. There are also other safety things which I need to look at as a surgeon when we do things in the small kids. These are robust instruments. So we have to be extremely delicate when I handle the tissues, and when I do my movements have to be extremely tempered. The other advantage with the robot is I can scale down my movements. That for me, I don't scale down my movements because we've been doing surgery for the kids for the last 25 years or so. But in case I want to, I can actually scale down to 1 to 1.5 or 3 also. That means if I move 3 centimeters, the instrument would move only 1 centimeter. So there is a lot of advantage with that. I can also change the magnification. So if I have a very small kid, or if I have a very small tissue, I can get the magnification anywhere from 3 to 10 times. So there are a lot of advantages in this. And then the safety aspects are significantly built in, and there is also a significant safety aspect which our anesthetists also have to look at when it's being done, because that also is an important part of the whole surgery. It's just not routine anesthesia that you can just give and then come out. There is a very specific way they give anesthesia to these kids, because we put in gas into the abdomen and they have to look at the blood pressures, they have to look at the ventilation, how the body parts are getting oxygenated, how is the brain being oxygenated. So a lot of things are specialized, specific for anesthesia also. So a lot of safety aspects are involved. You need people trained in robotics to do all this, to see that the safety is it's quite safe to our kids.
Are there any potential limitations or risks that are associated with the robotic surgeries?
No, I think the potential limitations are where probably you cannot use the robotic platform, or it's not amenable for minimal invasive surgery. But then in about 2% of these kids, we may have to resort to either laparoscopy or open surgery sometimes, because sometimes the instrument may not be sufficient for the small kid. Or if there is some problem during surgery, which there is nothing 100% in life, unfortunately, you may have to resort to open surgery. So there are, for every surgery, whether it's open or laparoscopic or robotic, there are limitations, there are complications. But all these are being done because the benefits outweigh the risks significantly. So they outweigh the risks by about 95:5 ratio. So the benefits are 95. You probably have a 5% risk. Out of that, major risks would be probably less than 0.5%. So that is why we tend to actually use the robotic platform. There are always inherent risks for every surgery which we have to take into consideration.
What advancements do you see in the field of robotic surgery, and how could they further improve patient care?
The next level of surgery would be fetal surgery. Now, a fetal surgery for myelomeningocele or the spinal problems is the standard of care in the West. We have done shunts in where we got the urine out because when there was a postnatal valve or something where it was hitting both the kidneys. We have done vesicoamniotic shunts where we actually took out the urine. But then the next segment would be fetal surgery, where if we can actually correct these problems right when the child is, when the fetus is growing, that's where we look at having a normal child being born. So the future would probably be that. The second important part of pediatric urology, apart from robotics, which we are looking at in future, is to identify a method to see what is the exact function of the kidney and whether this obstruction or the swelling is actually causing a problem to the kidney or not. So there are still more refinements which have to come in pediatric urology.
Could you share with us some of the success stories that you've seen with your patients who have undergone these robotic surgeries?
Yeah, I think probably for the last 25 years we've been operating and then been operating without much problems. And a lot of children are coming back to me, tells me that my surgeries are being fairly successful. One thing I'll probably tell you all is if anyone claims that he's got 100% success rates, he's actually bluffing, any surgeon. None of us would have 100% success rate. But what I could have so many success stories, but there are one or two children whom I can look at that, okay, I've done a good job and they've gone back happy. One of the recent ones was a 15-year-old child who came to me where she was leaking urine, she was incontinent, she was having fecal incontinence, that means she used to pass motion whenever and wherever she could not hold it. And then unfortunately because of a previous surgery, she had lost one kidney and she had a very small bladder. So we actually reconstructed the bladder, made the bladder bigger and created a small conduit or a catheterizable stoma through which she could pass the catheter and then empty the bladder. And then again brought her anal region to the normal position. And now she is both continent for feces and also urine. And I just want to see her grow much more beyond that. And these are the kids who actually, whom we have been operating for a long time. And once they come back and saying they are happy and they are going back to school and they are studying. I have a girl whom I have operated on this. She did her MBBS, she did her MD radiology and just got recently married. So all these people make me very happy.